Welcome to Building While Flying, a Sasha Group podcast where we interview business leaders about how they tackle challenges, stay resilient, and navigate ever-changing skies.
Welcome to Building While Flying. My guest today is Simmone Taitt, founder and CEO of Poppy Seed Health. Simmone experienced the gaps in emotional and mental support in maternal health care while navigating her own path to parenthood. After suffering multiple miscarriages with and without health insurance, she identified a better way forward for all birthing people. She became a birth and full spectrum doula and launched Poppy Seed Health in 2019. Welcome, Simmone.
Thank you. Thank you so much for having me.
So excited to have you here, to meet you. I felt like I knew you because reading your production notes, it's so personal. So thank you for letting us in, and thank you for sharing your story and building something that's incredibly poignant and needed. Before we get into the specifics about Poppy Seed Health, I wanted you to tell our listeners about yourself, about your professional journey prior to Poppy Seed.
Oh, wow. That's a really big, long resume. No.
That's okay.
But the majority of what I was doing in my life before starting Poppy Seed Health was actually building other companies for other people. I was lucky in that I was always in the early teams, right? I think over the last 16 or 17 years or so, I think I was kind of chasing my own tail. So I was going from, 20-person teams to 10-person teams and then to 7-person teams. So I think I very much am a builder at heart. Mm-hmm. I started right after college, if we have to go all the way back there, at a Fortune 500. Especially back then, it was the early 2000s. It was the thing to do. You go to a Fortune 500 if you can. But I didn't find it very nurturing or innovative, if that's probably like the best way for me to put it. Though I was in retail, and I always say that those were my, my character building years. Cutting my teeth in retail taught me a ton, but I jumped over to my first startup, 13 or 14 years ago, and I've never looked back. So that's what I was doing before Poppy Seed Health. And it was, I would say, across industry. So I always somehow found myself working for companies where I would say 90% of the core customer was a woman or a woman identifying person, okay. Right? And so I got to know that consumer really well, but also not to talk in third party. I am a woman, and I think I've always somehow found my way building for some of the gaps that I either was experiencing in my own life at the time, or I would be experiencing, okay. Right? So in my early 20s, there's no way that I would have known about how to save for my future effectively, right? But I ended up working on a product that really allowed for me to understand that for that chapter in my life. Very similar to Poppy Seed Health as well. I might not have been building that, Poppy 15 years ago, but I was working with and really understanding the customer and our entire life cycle of what we go through, in chapters as women. I think I was always building for this point.
Amazing. You also said something about consistently saying yes.
Yeah.
Tell us what that taught you.
Yeah, sure. So I was the person that people would come to always expecting that I would say yes because they had asked other people prior that would say no. And I don't think that's a bad reputation.
No.
I think we can talk about what it means to say yes and what it means to have choice. I was just really curious, and I like a big challenge. I like a hairy problem. And so coming to me, well, in the beginning, it was, well, let's go to Simmone. I think she'll say yes to this. At least she'll take it on. And then eventually I just made a name for myself. The reputation was, well, what's the point of jumping through the hoops of everyone else that's too scared to pick this up?
Right.
And they would come to me. And so saying yes just opened up so many doors for me in so many ways. And I don't mean just professionally, right? At one of my startups, which was a wellness startup, we wanted to enter the Central and South American market, pretty aggressively. Mm-hmm. No one on the team had done it before. No one wanted to take on more work. No one was very interested. And I raised my hand and I was like, I'll do it. Like, why not? Right? Like, for me anyway, it was just an opportunity. I also knew nothing about Central or South America markets.
But you were willing to do the work.
I was willing to do it. I did not. English is my first language. Spanish was way back when in, middle school and high school. But the point is that I didn't see any of these as barriers. Right. I saw this as an opportunity to be able to build something. And actually, it was that opportunity. It was the very first thing I will say that I built from zero for, another company, really inside, almost like being incubated. And it gave me the bug. Like, it made me realize that I could actually build something with pretty limited resources, by the way. They really understand how to do that from zero.
It's really amazing how it's a shift in perspective, right? It's the same opportunity. It's not changed. It's whether or not you look at it as an opportunity or look at it as something that's just terrifying.
100%.
The dynamics of it haven't changed at all.
Totally.
Amazing. So we mentioned in the introduction a little bit about Poppy Seed Health. It rose out of an emotionally poignant experience for you. Would you mind sharing a little more detail around that?
Of course. Yeah. I've been really public about my own personal story, and it's because I'm a founder and CEO that has now dedicated my life's work to solving a problem that I experienced firsthand. So I'll take you back to 2016 when I had my first pregnancy loss. And I had great health insurance at the time. I was seeing one of the top OBGYNs in New York City. And unfortunately, we couldn't find a heartbeat. And it was first thing in the morning. I was actually by myself. My partner at the time was traveling for work. And I went in pregnant and I left 20 minutes later, not pregnant. And I left that appointment with no medical, emotional, or mental health resources. The first part of this, with not having even the medical attention that I thought I deserved, the care and kind of attention that I thought I would get, that was shocking to me. Because my doctor not only was pretty cold about the whole thing and said that my body had terminated the pregnancy, which was just devastating for me to hear for a wanted pregnancy. Then she said, but it's normal. This happens all the time. I'll see you in your next appointment when you start trying again. And that was it. She left the room. And when I asked the staff on my way out if there was anything that I needed, because I think in most doctor's appointments, right, you walk out and they give you instructions or whatever. I didn't get that. So I'll never forget this, standing in the, middle of the busy morning traffic streets, because of course we're women, we do all these things before work. And I thought to myself, what is my body going to do? I have no information. I have no idea. And my only context, by the way, is what so many people still have today, which is what you see on TV or in the movies. And so I thought that there would be a lot of blood and pain and all those things. And that just wasn't happening with my body. And so I took to the internet. I went to Dr. Google. 85% of all searches in the US are people looking for healthcare answers.
Wow.
And I realized that especially when I didn't have health insurance and going through my very complicated infertility journey today. But so many people are going to the internet for answers, and that's okay, right? For so many people, that's their only accessibility point. But there's also a lot of crap out there. So we want to intervene on that. Anyway, I used my gift of discernment and I was able to find a few things that were an offer to me. I picked up the phone. I called my own healthcare plan back into my doctor's office. And instead of feeling relieved and taken care of, I was enraged. I was frustrated. I was upset. I was also deeply emotional, very, very sad. I was in a very dark place. And I was looking all day long to just feel better. And that is a universal feeling. And it wasn't until I happened to trip onto, I always say I tripped into this, and I'm really dating myself, but thread of doulas who were supporting someone else that had a very similar loss to mine, just a stranger on the internet. And just reading through their responses was so kind and loving. And for the first time all day, I felt seen, I felt heard, I didn't feel so isolated. And I sat back on my couch and I made two powerful decisions that evening. The first one was to become a doula myself. And I, like so many people have no idea what a doula is, different than a midwife. We do a lot of surveys, so we know this. And most people just think that a nurse feeds you feeds you ice chips in the hospital, which is not true. They do so much more.
Yes.
But I sat back on my couch and I decided to become a doula, which I am. And I did back in 2019. But also the second was the idea for Poppy Seed Health, which very simply was and is the biggest vision point for us. And that is to connect pregnant, postpartum, or people who are experiencing loss with doulas, midwives, and nurses in 90 seconds or less, immediately for emotional and mental health support. And we do that all via text.
Right.
We've tested a lot of things, but that is the thing that sticks.
Okay.
And, we've been around, we launched into the world in April 2021 after about a year or so of beta testing. But I can tell you that in just a year and a half, we've had over 3 million minutes of chat time.
I love that.
And that's just a lot of people coming to us to talk about the things they can't talk about out there. And so, look, as an entrepreneur and as a founder, I think for those who are listening who are similar, who are building things based off of your own lived experiences, there is nothing as powerful as being member zero, patient zero, user zero, customer zero, right? You will always understand the important nuances as you build. And I think it's so important.
I think there's so many lessons that are applicable regardless of type of business that someone is building from what you just shared. To me, like, I think about that doctor, right, saying to you, like, this happens all the time. And I think that happens in a lot of businesses, right? We sort of commoditize either the service or the product ourselves, like we're contributing to it, which is a really dangerous path to go down. When really it's like, it's personal for every individual.
That's
right. For every new person using your service or product, it is new. They care in terms of like mass for the sake of trust, right? They want to know that you've worked with more people, but like if you are missing treating it as personal for each individual, then you're missing the gist of it, right?
That's right. And that's not an easy thing to do.
No.
It takes a lot of attention and intention and time and executing on strategy, not just building the strategy,
Right.
but it also takes a lot of testing. You have to have a high propensity for experimenting and for failing, right? And really understanding what's working and what's not working. But, absolutely. I think it's so important to be able to have a point of view when you're building that's applicable to what you're building, because you just understand it at a deeper level.
And the other thing that stood out for me is you came at this from personal experience, but you didn't treat that as the experience that would be applicable to everyone, right?
That's exactly right.
You also did reading on what other people were seeing, how they were feeling, how they solved it, how they approached it. And I think that your own story was the impetus to listen to other stories and take those into account as well. And it can be so easy to put the blinders on. I know what this customer is. I am this customer. It's just, you are part of it. You understand some of it, but we all experience it in a different way.
You are so right, 100% right on that. One of the things that we decided very, very early on is that we are going to be a behavioral-led, product-led, pattern-led company, right? So I never loved building tech first and then thinking everyone's going to run after it. Absolutely not, right? It's so important to be able to listen to what's happening, watch the patterns and understand the behavior so that we're really actually building a product and an experience that people want. What we do at Poppy Seed Health is deeply personal, right? Like we are non-clinical in that people aren't coming to us for medical advice, but they're coming to us to talk about sometimes some of their deepest feelings, but they also come to us to tell us that they hate their partner and they're, overdue and they cannot wait to have a baby, or they're, coming to talk to us about their loss that they had 20 years ago and they never talked about, right? So it's so important that we listen, and we do a lot of that at Poppy.
So tell us a little bit more about how Poppy Seed Health works.
Yeah. So very simply, we decided that it was important to have our user experience be the easiest navigation on planet Earth. And we still say that. We think it's really important to remove any friction. So in doing that, because we had been beta testing and we were super scrappy, we did it on WhatsApp.
Okay.
And in just under a year, we supported just under 1,000 people who just found us, right? Just in the world, which is always so shocking to me still. But that just tells you kind of the signal of need that was out there. And so we were trying on WhatsApp. We said you could call, video, or text. And not one person used video. In all of that time, not one person requested a video. We had one phone call in the very beginning, but we were sending through thousands of text messages. So it was very clear that text was what we wanted and where we thought people could do what I call expert anonymity. You don't have to look at me and tell me that you have hemorrhoids in your third trimester that no one talks about, right? You can actually text and get the support that you need. So it was very clear to us that we needed to build an app. And so we did. After raising our first round of capital, we actually built 3 products at once. So our flagship product is Poppy Seed Health, that is available in both the App Store and Google Play for both Apple and Android. For accessibility reasons, it's very important to us. But what's powering Poppy on the back end is an API, which is ours, and a back end, which is proprietary to Poppy. What we have there is the magic that happens in the background. So very similar to like a dating app or a car sharing app. Our matching algorithms within milliseconds are taking the self-reported information you're giving us during onboarding, right? If you're pregnant, postpartum, loss, like whatever it is. And as soon as you request a chat on Poppy, publicly, we say within 90 seconds or less, one of our advocates will pick up your chat. But what's actually happening is that if you're pregnant, you're never going to get anyone that's just a postpartum nurse. You're not going to get someone in loss, right? It is matching you for exactly where you are in your journey. Our actual latency is 9.5 seconds. Actually, as of last month, it was even shorter. We were down to just over 8 seconds.
Wow.
So in less than 10 seconds, you're going to get someone in a one-on-one secure conversation, all private, all your space.
That's amazing. No
shame, no stigma, right? I mean, it is my wildest dreams that I had this back in 2016 and I didn't. But anyway, that is exactly how Poppy Seed Health works today. And I just want to add one more thing because I think it is important to say this. We went to market direct to consumer. I love being close to the consumer. I'm not afraid to try and figure out what's happening with the individual, right? And then, being able to build something that has a lot of value.
Because the alternative would have been going to doulas, right?
Well, the alternative, and it's harder to say this today because I think so many things are popping up in the landscape, but our number one competitor, let's just say, are these chat groups, which is not bad. There is a place in the world. But from our own surveys, most of the folks who are in those groups are not participating. And I believe deeply in participatory care, right? And so when you're not participating, but you're kind of just voyeuristically there to read through the things, that can really influence how you feel about yourself. It can almost, and we've heard this word be used too many times, which is they feel bullied and they're not even participating, right? So it's really psychologically very interesting versus being in a one-on-one conversation with one of our advocates. We have the largest network of non-clinical advocates across the country. We're in every time zone in every state. So you could get someone, you could be sitting on your couch in, Kansas, and an advocate in Connecticut will pick up your chat, right? But that's because accessibility and expediency are so important to us, right? You're building a relationship with Poppy Seed Health, not necessarily with that advocate, but in the moments that you're chatting with that person, we hope that you feel safe, that you feel seen, and that you feel heard, right? And that's really important. So I guess, yes, the alternative are the Facebook groups and those kinds of things. But for us, I will always say this, the biggest obstacle that we'll ever have to get around or over, I should say, is that behavioral change doesn't happen overnight, right? And our cultural narrative is that we should keep everything inside. especially as we are going through these milestones in our reproductive health years in life. So you're supposed to be really happy when you're pregnant, and you're supposed to be thrilled when you have a cute little baby. And when you have a loss, you're not supposed to talk about it. So our own worth and the narrative that's out there are totally misaligned. They're not aligned at all. So that will take time for someone to feel worthy enough to push our request chat button. And usually that's the biggest obstacle to get over. But we're working on it.
Love it.
So we created Poppy Seed Health, and we created the app because we knew from an accessibility standpoint that would be the most important for people. So it's all proprietary technology for us. We've built Poppy Seed Health from day zero. And when we were in the architecting, so before we even wrote one line of code, we took all of the learnings that we had from our beta, which happened to be on WhatsApp. And we poured all of those learnings into building a product that we knew foundationally would be really secure. And when I say secure, I mean secure, yes, and privacy and those kinds of things, especially right now as our reproductive health care rights are under attack. And we really think about privacy very, very seriously. But we knew, and I think maybe one of our biggest differentiators that I knew from the very beginning was that where nurses, doulas, and midwives are geographically constricted. Right? You are only within a certain mile radius of where you're seeing patients or your clients or whatever it is. We built Poppy to be an extension. So we built the technology to be an extension for people to do the work that they already love doing. So if you look at like a driver on a car sharing app, right? You are getting into a car with a perfect stranger, but you're expecting the same exact service and quality that you would with any driver that you got in a car with. You can never convince people that they would get in cars with strangers a few times a day, but we do. And that's how I see Poppy Seed Health, because there was no way that we could come in and fully build something new for maternal health care in the existing health system that is just not working for people. Right. And in addition to that, I believe deeply in technology bridging the gap for folks. We have nearly 7 million people who are in their reproductive healthcare years that live in maternal healthcare deserts in the country. That's rural America. That means that they live 90 miles or more from their closest provider, hospital, or clinic. Yep. So leveraging technology and building our own tech to do that is very important for Poppy, our beginnings, but even more important for our future.
Yeah, I don't know the statistic, but I would venture to guess that I could make the statement there are more people with cell phones than there are with health insurance.
Oh, 100%. Listen, we get dinged on this all the time, which I think is so interesting. Dinged is probably not the right word. I get pushed on this all the time, right? On the venture side, on, not the consumer side ever, but like the brand side of things. And here's the thing. We today, and I'm really proud of this because it is baked into our business model. In our first year, we supported 30% of everyone that came to Poppy are Medicaid. We very intentionally put this in our business model before I hired one person. And so when we talk about accessibility and equity and democratizing access to care, that is a part of Poppy's DNA. But I still get pushback on, well, people who are on Medicaid don't have cell phones. They don't have technology. They don't have broadband. They don't. And that is not true.
It is not.
If they have anything, it is a cell phone. And that's it. So we might not have good broadband, which is like shame on us. I know that we are working very quickly to get that into the neighborhoods and communities that need it the most. Yeah, sure, you don't have 3 laptops in a household. I understand that. But everyone has a cell phone.
Absolutely.
And when we actually built Poppy, we built very specifically so that we could release on both for Android and for Apple at the same time. And so anyway, we have cell phones, y'all.
I think that's huge. Well, and I don't want that to get like hidden. Launching on both is critically important.
Yes.
It's only this year that there is parity. Prior to that, it was majority Android users. And so there is a significant portion of the population that gets left out when most apps are launched.
100%.
Yeah.
And we love Apple and we love Android, but it was a decision that we made way before we started building. It is also data that we were collecting way before we started building.
Yeah.
And I know, we are building as we're flying a lot of times, but, there are moments that we want to sit with the information that we have in front of us, the kind of business insights that will be foundational to your company. They certainly are for Poppy, and building for both at the same time, Android and Apple, was a really big foundational business decision that we made.
And
I'm very happy we did.
I think it really brings us full circle, right? Because you started out by telling us about your journey prior to Poppy Seed Health. You talked to us about like being willing to go down the path that nobody had gone down before, but also not accepting how things have always been done. And to me, that's a way of not accepting that just because that's how it's generally done doesn't mean that's the way that it has to be done. And it created an opportunity for you to make it more equitable in terms of the access to it. I think everybody has the opportunity to do that, right? Like there's more opportunity for innovation by asking like, okay, I know that's how it's generally done, but do I have to do it that way? And what is the opportunity? I always think of cash only businesses, right? One of those of like, the sake of technology. Like, it's amazing. Sure, I think it's amazing that I don't have to carry cash. But so not everyone has a credit card. And it kills me. I'm just like, I understand if you're doing it consciously, but you are cutting out some folks. You are saying in a way that you may not realize, you're saying some folks aren't welcome here because this is a no cash establishment. But just an example of how like we should all challenge, and especially if you're building something, challenge how it's always been done and see if there's an opportunity for you to do it a different way.
That's right. Listen, I think if we were to sit here and quickly come up with a definition for accessibility, I promise you that everyone in this room would have a different definition. A lot of times accessibility is based off of our own lived experiences, how we see ourselves moving through the world and how we see others. And accessibility is not easy to get right. We will inevitably and unintentionally a lot of times leave folks out of our definition or even what we're building. The important thing is that we have to be really flexible. And I keep saying intentional because I think that is at this stage for us anyway, being, early stage, it is about we have the opportunity now to be really intentional about all of the decisions that we're making early on. But accessibility for us at Poppy Seed Health means that we are here for all. And I know that there's this trope like, don't boil the whole ocean. You can't be. And I'm like, no. Here's the thing. When I say we're here for everyone and we're here for all, we don't care how you identify. We don't care where you live. We don't care what your socioeconomic background is. We are able to support someone who is unhoused right now as much as we're able to support someone who lives in a mansion in Beverly Hills. It doesn't matter. Accessibility for us means that everyone is getting the same care and access and support and attention when they come to Poppy. Does that mean that can look different for folks? Yes, but that's why we've built such a very robust data foundation to build Poppy on. Yeah. So we know if you're on Medicaid, we know if you're experiencing something like postpartum mood disorders or depressions, when we can actually escalate that. We know these things because you're telling us, you're sharing it with us. But more than anything, we don't care who you are and where you're coming from. You deserve that kind of support, right? So I don't know that we were going to go there with accessibility, but I'm glad that we did.
I'm glad too. We could probably talk for hours.
I know.
But sadly, I'm going to wrap it up with one more question.
Yeah.
And that's, what should we expect to see from you in terms of growth?
Yeah. So excited about this next chapter of Poppy. So we actually, at the end of 2021, we decided to follow these patterns, and our door was getting pounded on by employers, which is not surprising, right? Employees now, especially in hybrid work, working at home and remote, coming into an office, but family benefits goes far beyond what's like health insurance covered these days, right? And we also know that coupled with that, our mental health has been under attack, completely pummeled. So think about that compounded for people who are somewhere in their reproductive health journey. They're pregnant, they're trying to conceive, they're thinking about conceiving, they, are postpartum and have babies at home. So we have started working with employers. I'm very excited about that. We officially launched that part of Poppy, so Poppy for Employers, in Q3, so just a few months ago, and I'm really, really happy about that. And that's been going very well for our growth. But then the next thing, which it should not probably be surprising, is we want to be everywhere that our people are. Right. And your people are Poppy people. I trust you. Trust me. It's your next door neighbor. It's your coworker, at the desk next to you. It's your, grocery store checkout person. They are our people. They are Poppy people. And so without a doubt, payers, so that would be health insurance companies, hospitals and clinics, we have built a solution. We've built an army of advocates across the country. When we started with 40, we have over 400 active. We have an active wait list of over 3,000 advocates. Wow. That's nurses, doulas, and midwives that we are able to deploy at any time. And so we're very, very excited about our payer relationships and the conversations that we're having today with health insurance companies, because we know across a full spectrum between commercial and Medicaid patients that maternal health care is so broken, and we can bridge the gap very, very easily for them.
I'm smiling because I'm super excited to watch the growth, to see you fly.
Thank you.
Thank you, Simmone. This was amazing. And I can't wait for our audience to hear your story and learn about Poppy Seed Health, and also share it, because we all know someone who needs it.
Thank you so much for having me. This was so much fun.